Happiness Wellness Talk, where together we will discover how to live well. Okay, hello everyone, welcome to Happiness Wellness Talk. Today we have a guest and he decided not to show up his face, so I'm gonna be talking on the screen by myself, but he's gonna be on the show the whole time. Okay, he's here. Okay. And welcome Daniel. Hi.
Hello.
Hi. So what kind of specialty are you in?
I do vision therapy, so my type of patient will be learning disability, kids with autism, fine adjustment after like lazy surgery, or brain trauma, anyone with car accident.
Mm-hmm. Okay, so which type of patient do you see most in like their kids, like?
For my
children?
practice, most of my patients who are kids, they either had autism or they have reading comprehension problem or binocular disorder.
Binocular disorder. So what does that mean?
That means they're not able to efficiently using both eyes together, focusing on one thing for their reading. So they will probably have one eye reading and the other eye is just designed not to work. So basically you're standing on one foot.
Okay, and all of the explanation from here is based on their nerve are not damaged. It's just the function wise they're not using it.
Yeah, they're not using it. So our job is recreate the environment so that they can relearn how to use them correctly.
To relearn this, to connect to this world, right?
Mm-hmm.
Okay, so for autism and also the learning disability you just mentioned earlier, how do you help these kids?
So we recreate the environment. Mm-hmm. So we give them activities. So when they come, it's like a one-on-one tutoring. Mm-hmm. We give them activity to do to recreate the environment that they're supposed to have when they're growing up, and so that their brain can pick up what to do with their body.
So to explain in the other word that people if you are not understanding what we are explaining is maybe the kids are not seeing the world like we do. It's like how do we explain that? So we perceive the world based on what we see, but these kids, they may not see what we.
They are not approaching the world that we do efficiently. So the information that comes through their eye go to their brain is not as the same as what we see as all the other people. So what we do is we recreate the past or we make it more efficiently so that they can see what we see right now.
Yeah, so to train their brain, basically, right? Okay, so when you're training their brain, what do you use? Would you use any tool, any way to help with these kids?
We use metronome, like music, the things that you use are learning music instrument. We use balance board.
Okay.
Training the body.
Balance board in the physical therapist session, those balance board that they stand on?
Yeah.
Okay.
Balance board.
And what was the metronome? Is that only the musician know?
No, it's a regular metronome.
Okay, so it's the timing.
Tick-tack.
Tick-tack timing for the piano learning session. And what else?
We also use lenses.
Okay. Different type of lenses?
Different type of lenses to help them recreate the environment that's changing focus.
Okay, so for example, nearsighted, farsighted patient, they might need this training to get back to
get their eye flexing.
Okay, so you're training these muscle.
Training the muscle as well as how the brain can control their eye through the muscle.
Okay, so as a chiropractor, we often learn about like the cranial nerve. There's 10 cranial nerve in our brain, and especially for eye, there's 4 cranial nerve that was for eye. For example, cranial nerve 3 ocular motor was for the eyelids, opening up the eyelids to open your eye and respond to the light constriction of the pupil. Pupil. I just got a word stuck. So basically, when there's a light, your eyes knows to constrict. And then the cranial nerve 4, trochlear motor nerve, we are working on rotation up, down, left, right. So your eyes can rotate. You can move to a different angle. And then the next one would be the cranial nerve 6, abundance nerve, that will have the rectus muscle work to look to the side. So you know how like the lateral vision, when we are trying to look to the side, that would be the cranial nerve 6. And then 3 of them were the motor and sense. One of them is a combination of the sensory and motor. The other one was cranial nerve 2, the optic nerve of the sensory. For our eye is the vision sensory. So all of these are connected to the brain, and like 4 out of 10 cranial nerve was for eye, for the brain. And that again touched down to what Daniel just mentioned. He has been training these kids to train their brain to relearn, to rematch these things to the world that we see, right? Okay, so that is very interesting that we have these autism patients, we have these learning disability children that need extra help from these certified vision therapists. And you mentioned like 70 to 80% of the
information that we gather from the reality to our brain is through vision.
Yeah.
Imagine the world. And just close your eye and then you will see the world
differently.
differently.
Okay, let's close the eyes right now. What do I see?
Yeah, you'll feel the world differently.
I hear your voice, and you guys won't see him because you're already not seeing him in the screen. But it's like you don't see it.
So the information without the eye is totally different, and most of our information are through the eye. So we train the brain using the vision, basically 80% of your information source, to retrain your brain how to connect to the world.
And to learn, like we mentioned, that the metronome, so that will help with the patient to learn.
After your vision, what we do is we do integration with all the other sensory, like auditory sensory, and also we have touch, we have smell, and all the other sensory. So what we want to do is you're not just looking at things. You want to be able to look and listen at the same time.
Yeah.
All right. There's a lot of people, their brains are so focused, so they can only do one thing. They can only look, but they lost the listening part.
They're not perceiving what they got.
For example, if we have the class, there's some students, they're having difficulty. When they are looking, they're really only looking. Whatever the teacher taught,
they're not listening. They don't hear what they were
Yeah, it's
hearing.
not like they don't want to hear it. It's just they're physically there. The information is, their ears are totally fine. They're still listening, but they
hear the noise, but they don't.
The auditory information is just not getting to the brain. So what we're trying to do is we're trying to make sure these things are efficient for the brain, so that the brain can do both of them at the same time efficiently.
Yeah, that's really good. So for that, and also we learn. You mentioned that how to perceive the world, and was that related to the time and space? Is that?
Yes, we also train time and space. Spatial awareness is one of the big things in vision.
Yes.
All right, and
so you can we know this flower is not here, not in front of my face. It's like one arm distant that this is the plant over here. So that's a time and space. So for example, I know this, and also perceive at the sunlight or sundown, I kind of know right now it's at night or at the daytime. Is that what you train them to learn?
Yes, but more, this is like a more
more deeper.
Different way.
Yeah.
More different way. I have patients who are having difficulty recognizing this is their right and this is their left.
So they don't know this is their left side. They will say this is the right side.
Yes.
Okay.
So,
and then what would you do?
We will actually help them in some other activity to make sure they're recognizing their recognition is matching the reality. Like this is their left side, not the right side. And what we can do is which hand do you use in using this using the pen? Most of them are right-handed. They will say, "Oh, my right hand." All right.
And so
and then you touch
pen?
your left hand, and then say, "Is this your the hand that you use for writing? For writing?" They'll say no. And so is this your left hand or right hand?
So you keep reminding them and
to help them recognizing which part of the body.
So what they see is what.
Yes, what they recognize is matching the reality.
Okay, so these are for we still at the kids part. So as a parent, when would you recommend like how the parent would know? For example, like how the parent should know when to see a eye doctor, or how the parent would know that their kids actually have these vision or recognizing difficulty.
So it is important that you have insurance so that you can take your kids to eye doctor annually without maybe with just a co-payment.
Yeah, so without extra cost, you may be able to have a exam.
So it is very important to take the vision exam annually so that you can any of the symptoms that you see in young childhood, you can catch them very early and then start to if there's any problem, you get it solved with ease at very early age.
What was the youngest age that you have seen?
In my clinic, the youngest age that we ever seen will be like two or 3 years old.
Okay.
But that is through like a playground environment to help them relearn. For me, I'm not a baby person, so what I do is I start seeing patients who are like 7. Basically first grader when they have some type of learning ability, and then to age like 55 or 60.
Okay, we'll go into the break and then we'll come back to other conditions that we may encounter in adulthood. Okay, see you later. The information shared on this podcast does not replace any medical advice from your doctor. Our goal is to inspire and share our personal stories on health and wellness. Okay, welcome back to our part 2. So we just mentioned that there are some condition that has been treated with vision therapists for children, and now we're going to talk more about what we would see in adulthood. So I think you mentioned earlier some of the adulthood they would go into LASIK center for their eye surgery.
Yeah, so I do is fine adjustment after LASIK surgery. So usually after LASIK surgery, none of the surgery are perfect. So there is going to be like minor prescription left after the surgery. What I do is instead of doing the second surgery, to get the prescription perfect, instead is what we can do. We can actually retrain the brain how to gather information more efficiently with their eye, so they don't have to do the second surgery and they will still see a perfect world without glasses.
Is it common to have a residual prescription after surgery?
It is very common.
Very common. So
like a minor prescription, like a minus a quarter plus a 50, so that is acceptable.
So acceptable, but how long
even
does
a lot of people out there without glasses, they all have minor prescription.
Oh, okay.
They all have minor prescription there. Their brain is able to overcome these minor prescription so that they don't have to do anything with glasses without extra help. Glasses are extra help.
Okay, so and also keep the prescription stable. Is that correct?
Yes. So they know how to use their eye properly so that they don't have their prescription grow based on their old habit of not using the eye correctly. That's how you to your prescription in the first place.
So we don't like to wear glasses, but a lot of us, like 9 out of 10 we are on our like blue light screens. I watch iPhone or our laptop, everything. We are on the screen all the time. Is there any specific thing that you would want, like, teach us to protect
recommend every hour, 30 minutes, you should stand up and looking somewhere far if you're actually using something close up for a long period of time, like using your cell phone or iPad, all those kind of things. So stand up, look far, and then for like 2-3 minutes, get your eyes relaxed. Looking far is actually relaxing your eye, and then sit down and then do whatever you want to do.
So everyone is mostly working from home during this 2020 pandemic time. So what can they do at home?
Set an alarm every an hour.
And then go back to the yard or look out the window?
Yes.
Okay.
That's why I would recommend if you it's the most efficient way without any that doesn't cost any money. You just stand up and looking far, so that way that protect your eye. Other thing is, if you really want, you can have, we train you how to control your eye muscle so that you don't have to stand up, you don't have to look far, but you're actually relaxing your eye on your well.
Okay, so learning how to train these eye muscle and train your brain from certified vision therapists. And we mentioned a lot of condition for kids and adulthood, and also the LASIK after surgery. What is a common treatment plan? Like, how long would the patient will be in the treatment, and when would they start seeing a improvement?
Depends on their symptom and also their condition. Our session usually come with like a package, like 3 months. So, but our session are weekly, and they come into our office 30 minutes weekly, and then they will get homework to do at home to practice with their eye or with their brain, and every single day. And then they come back again next week, and then we reevaluate what the condition are, and then and give them other activity, other homework to do at home, and you will start seeing improvement in about 4 visits.
So within a month, after a month, you will probably see some significant difference, and patient yourself need to observe what's the changes throughout the time when you have these different homework every time, right?
Yes.
Okay, so these are the treatment plan for these patients, and also you mentioned, like earlier when we were talking behind the break, what would be other condition that adulthood would have? Because you did told me that a lot of time it's not that they build up after they grow up. It could be that they already have that condition.
So so a lot of symptoms that appear when they are in their 50s, when they start getting older, is they already had it in their young age. It's just that their brain is very powerful. It could overcome these difficulty. But once you get older, your brain is not as strong as before. These difficulties start to appear. All right, it's not like it doesn't exist. It's just that your brain actually was overcome these difficulty. So what we can do is we can retrain your brain how to control different part of your body more efficiently, so these difficulties can be overcome again.
I see. Okay, so thank you for this information. We're going to go into another break, and then we're going to come back to other conditions that we chiropractors see a lot, and how is that connected to a certified vision therapist. See you later. The information shared on this podcast does not replace any medical advice from your doctor. Our goal is to inspire and share our personal stories on health and wellness. Okay, welcome back to part 3 of our session today, and we did mention a lot of condition, and also how after a month we would see a significant difference after a vision therapist session. So For me as a chiropractor, we used to see some car accident patient. They would have a concussion syndrome after a major accident. So when they do have a concussion, they may have some condition like light sensitive, blurry vision, or cognitive problem. A lot of time that after our exam, if we notice that their brain is not damaged, the nerve is not damaged, the muscle are functioning properly, there's no radiculopathy problem, there's no nerve sensitive problem, we would recommend the patient to see a physical therapist for their muscle condition. But when it comes to the eye problem, a vision problem, we now know that we can come to a vision therapist for this type of condition. So do you have any experience with car accident patients when they have this type
yes,
of problem?
I do. After car accident, basically brain trauma patients, they will have difficulty controlling their body with their brain. Mm-hmm. What we do is through the therapy, we recreate the past of their brain controlling their body, so they can actually relearn how to use their body more efficiently than what they are right now, like after the difficulty, and then so that they can match to the other side of the body, or the reality, so that they can control it more easily.
So let me give an example. For example, when they're raising their arm, one side of the arm they may lift to their shoulder level, but the other side of the arm they may not be able to lift as high. But in their brain, they're thinking that what they recognize themselves is they think this is even, but in reality, we as a observer, we see this condition like they're not matching the reality, they're not even. So is that a type of condition that you're treating?
Yes, so to help them recognizing they are not matching the reality, mm-hmm. and then also if there's not no physical problem between the arms, condition between the two arms, mm-hmm. how we can readjust so the brain can actually recognize it, mm-hmm. and to bring a level so it's matching the reality.
So what we mean by there's no physical problem means the nerve is not damaged, the muscle are functioning, it's just that their brain didn't know how to control these muscles to make it even for the movement, right?
Yes, mm-hmm. Even if the brain, if the nerve is damaged, we can actually try to recreate the path.
Okay, stimulating the function, right?
Yes.
Okay, so we can also train the damaged nerve, but not a dead nerve. Okay, yes. So there's a lot of possibility when you're injured. It's just like myself. I did see stroke patient with acupuncture, and then he was like paralyzed one side, but we were able to use the acupuncture to really stimulate the nerve and the muscle. And he was able to get back to standing and walking and go back to work in 6 months. So that was amazing part about our body, that we can recreate a mm-hmm. new life in this way when we are training them. So thank you, Daniel, for sharing this information. And it's mostly a functional medicine-wise of treatment for our patient, and to help our patient recognize their body, recognize the world, perceive the world, and to really see the world like matching everyone else's reality. Thank you, Daniel. Thank you.